With a landmass spanning 1,171 square kilometers, Lagos is the smallest by size, yet it remains one of the most popular cities, not only in Nigeria, but in the whole of Africa, accommodating about 2,000 new people daily, who often become full-time residents in the center of excellence. This is Inside Lagos. I'm Adedoja Salam Adeni, and you're welcome to the show. Lagos State government has dedicated year 2023 Planting Day to honor health workers on the front lines of the battle against the COVID-19. The ceremony, which held across the 57 local councils and isolation and treatment centers, had its main event at the state's epicenter of the fight against COVID-19, that is Yaba Infectious Disease Hospital. We were there. As the world continues to grapple with the onslaught of the virus pandemic, leaving whole economies of cities virtually grounded, issues of health and environmental safety are paramount now more than ever. Hence the theme for this year's Tree Planting Day, Trees for Life. This is the third time in a row this year that Governor Babajide Sanwo-Olu will be dedicating special days to health workers on the front lines. First was May 1st, Workers' Day. May 29th, the first anniversary of his administration, and the 14th of July, Lagos Tree Planting Day.
In honor of COVID-19
all these, he says, are to further appreciate the role of the ones who put their lives on the line to save others.
Today's Tree Planting Day, which has a theme, Trees for Life, is dedicated specifically, especially to all our heroes on the front line of the coronavirus pandemic response. And so that is why we're here today at the mainland hospital in Yaba, the epic center of our fight against the pandemic. As you know, these are challenging times for the world, and the corona pandemic has drastically altered the way we live our life and do our business. There is no new normal. This is now the new normal. And it is the beginning, and it's becoming clear that we may never return to the old days of doing things. And so for the third time in a row, we are acknowledging again all our frontline health workers. You will remember that on Workers' Day, May the 1st, we acknowledged them. We dedicated the Workers' Day to our frontline health workers, and they were so acknowledged. On May 29th, which was also the first anniversary of our government, we also acknowledge again all our frontline health workers on the COVID-19 and all of the great works they're doing. This is going on concurrently at 3 other isolation centers, where you have Mr. Deputy Governor, you have the First Lady, and also the wife of Mr. Deputy Governor, and all our 57 chairmen doing the same thing, acknowledging and recognizing all our health workers because of the situation that we have globally. COVID-19 cannot become an excuse for taking our attention away from other issues. One of such other issues is climate change and environmental sustainability. Lagos has seen its own fair share of climate change. As a coastal city, we are at the mercy of the rising sea level. You all know very well how rain comes in around us, especially during this time. As Africa's most populous city, we have seen how demographic pressure has stripped the landscape of a significant amount of its forest cover. I'm sure you know the demographic numbers very, very well. How Lagos State represents less than 0.4% of the total landmass of this country. And it's a city that is also below the sea level. And so issues and concerns around climate change is not something we will take for granted. As a city and as a government, we have a duty and a responsibility to respond swiftly and comprehensively. I'm pleased to know that over the years, Lagos has taken this responsibility very, very seriously. Way back from 2008, we have dedicated July 14 for this simple exercise. We draw to the final decade of the push for the attainment of 17 SDG goals as outlined by the United Nations. Everyone has a role to play in contributing strongly to these goals. As individuals, as a government, as corporate organization, as national government too, we have a role to play. Goal 13 of the Sustainable Development Goals challenge us to take urgent action to combat climate change and all its impacts. Goal 15 seeks to protect, restore, and promote a sustainable use of the territorial ecosystem, to sustainably manage forests, combat deforestation and desertification, and halt and reverse land degradation and halt biodiversity loss. These two goals encapsulate our responsibility to continue to take the climate change very seriously and to do everything in our power to tackle it. Let me also use this opportunity to reiterate that Lagos State will continue to be at the forefront of a sustainable climate action in Nigeria and in West Africa. You will agree with me that we can draw parallels between the protection roles the tree plays in our environment and the roles our health workers play in protecting us from diseases and from the pandemic. It is therefore fitting that we are planting trees today to celebrate and to support our health workers. And just as these trees will grow and grow to outlive us, the heroic feats and the sacrifices of our frontline health workers will also never be forgotten, even longer after the pandemic is behind us.
For the Commissioner for the Environment and his health counterpart, the synergy between their two ministries cannot be overemphasized in saving lives.
In 2008, under the administration of Mr. Babatunde Fashola, that the Lagos State declared every June 14 as the Lagos State Tree Planting Day. And this was further established as a statutory responsibility of the Lagos State Parks and Gardens, LASCA, with its law of 2011, Section 20 and Subsection 1. Trees constitute life, and tree planting is one of the deliberate climate change measures of the present to support the United Nations Sustainable Development Goal 13, one of the 17 global goals that make up the 2030 Agenda for Sustainable Development to combat climate change and its impact. Trees, as we know it today, are essential to life in the sense that it adds oxygen, cools our houses, removes carbon dioxide, reduces emissions, provides fruits and medicine, and prevents flooding, fights desertification, and controls erosion. To date, over 7.6 million trees have been planted since LASCA was established in 2011. In addition to this, tree planting has contributed in no small measure to the present administration's goal to achieve a healthy and sustainable environment, which is a key component of the theme's agenda of the present administration. The interdependence of man and the environment in which we exist is becoming increasingly clearer. And as countries respond to the global pandemic, the path ahead represents possibly a once-in-a-lifetime opportunity to shift the global development paradigm towards more sustainable and inclusive policies that will act as foundation of resilient peoples and society. That is what informed the choice of trees for life. This is our specific response to the COVID-19 pandemic and the efforts and dedication of all the healthcare providers who have stood on the front line in the battle against the scourge of the disease for the detriment of their health and well-being.
Health and environment have been joined together in the visionary agenda for this government, where we will be promoting the concept of One Health, The WHO recognizes that we look at health holistically now. The health of human beings is intricately intertwined with the health of the environment and the health of the food that we eat. We all talk about COVID-19, and we are very grateful that you've dedicated this tree planting session to the frontline workers. COVID-19 is not a virus. COVID-19 is a phenomenon, and it represents the fact that we have not clearly understood the synergy between environment and health. The disruption of the environment is what is responsible for all the zoonotic infectious diseases that we're seeing around the world. Things like Lassa fever, monkeypox, Marburg, Ebola, and now we have COVID-19. So COVID-19 is something that has moved from the ecosystem into the human population because we failed to be good custodians of our environment. And so today we mark the fact that Lagos State, in its wisdom and at its second pillar of the theme's agenda, fuses health and environment together. So on behalf of the Ministry of Health, we dedicate this day to all the frontline workers that have selflessly been offering their services in the combat against COVID-19 and have done excellently well. We recognize you, public health physicians, environment health officers, pathologists, epidemiologists, nephrologists, intensivists, nurses, hygienists, all doctors, health administrators, all security specialists, all those involved in every way, drivers, ambulances. Today we commemorate the fact that all Lagosians truly appreciate what you've been doing to keep Lagos safe so that we can carry on with economic activity, livelihood, and welfare.
Planting a tree requires a site, tools, seedling, nurturing, and then you sit back to enjoy the fruits of your labor. Environmentalists say planting a tree is not just for future enjoyment of its shades, but human continuous existence may actually depend on it.
Lagos State Health Service Commission has announced the commencement of a recruitment exercise for medical professionals into general hospitals across the state, with the opening of a recruitment portal, jobs.lagostate.gov.ng, for interested applicants. The Commission's decision to fill the vacant positions in the 27 general hospitals across the state followed the approval granted by the state governor, Mr. Babajide Sanwo-Olu, to increase the staff strength of medical personnel in the hospitals. According to the Commission, some of the vacant positions for employment opportunities include that of medical consultants, medical and dental officers, pharmacists, nursing officers, pharmacy technicians, dental therapists, and dental technicians. While noting that the recruitment portal, jobs.lagostate.gov.ng, will only be accessible for 3 weeks, from Wednesday, July the 15th to Wednesday, August the 5th, 2020. The Commission is emphasizing that it would not entertain or welcome submission of forms in its office in view of the COVID-19 protocols.
In line with the policy thrust of Governor Babajide Sanwo-Olu on health, the Lagos State AIDS Control Agency has distributed 1,500 sterilizing kits to the Association of Barbers and Cosmetologists in the state to aid HIV prevention as well as enhance COVID-19 prevention control. We were there. Hairstylists, manicurists, and barbers are among the personal care professionals whose small businesses are struggling amid the COVID-19 pandemic worldwide, Nigeria inclusive. A trip to the barber shop, hairdresser, or manicurist was a routine before COVID-19. But as the disease spread rapidly, many of these businesses had to shut their doors to slow the spread of the respiratory virus. On the 3rd of July, during a COVID-19 briefing, Governor Babajide Sanwo-Olu said opening of barbers and hairdressers' shops will be on appointment basis.
Let me also now finally identify a few other moderations that we have. There's been conversations around hairdressing salons, and barbing salons. I think it's important that some of them have been accredited by the Safety Commission and will begin to allow them to open. But it will be opening on appointment basis, meaning that between the hours when they open, they must have had an appointment. For you to come in at 3 o'clock or at 12 o'clock, you must have had a prior appointment with your hairdressing salon.
Lagos State AIDS Control Agency has gathered these executives of registered barbers and hairdressers associations in the state. 1,500 of them are collecting sterilizing kits to aid HIV prevention as well as enhance COVID-19 prevention control. The Chief Executive Officer, Lagos State AIDS Control Agency, Dr. Monsurat Adeleke, while addressing the beneficiaries on the kit distribution ceremony, stated that the event is one of the strategies the agency is adopting in achieving the UNAIDS global eradication of new HIV infections by the year 2030.
What it is that we have registered barbers and cosmetologists in Lagos State. So we've chosen them, and we have 1,500 sterilizing kits that was procured by the Lagos State government through our chairman that doubles as the incident commander. So why we're gathered today here is that we know that in the last brief, the governor also mentioned about, as we're phasing out the easing of the economy, we know that when we open the economy, one of the very first ports of call by everybody, irrespective of sex, race, and all of that, is the barber shop and the cosmetologist, because we haven't been going there for a long time.
This, according to her, also aligns with the state government's face-by-face reopening of the economy after the COVID-19 lockdown in the state.
We have representatives from the 20 LGAs, so we sensitize them, reminding them about the protocol for infection prevention, which is that if anybody is not wearing a face mask, please don't allow them into your shops. If you don't wash hands, that they should have a bucket or a sink outside their shops and ensure that everybody washes their hands. They should please practice social distancing. That is, they shouldn't have too many clients in their shops. So we're not only talking about, the prevention through the sterilizing kit.
The beneficiaries know they are critical associations and stakeholders in HIV control. They said this will improve their performance on the job.
With the pandemic around, and before then, it is right for us to sterilize our implement before using it on the general public. So it's a very good thing the Lagos State is doing for us.
This is one of the most important instruments that we are using. This is a sterilizing kit. And it's very, very necessary in a barbing salon.
Everybody in concern as regards to what we are witnessing today. For the truth is that it helps to curb the issue of spread of diseases and other things that has to do with the hair that will cut and skin as well. And I believe that for the fact that we too are taking our own measures as an association, this one is a plus and also a boost to us as association members. And it also shows that Lagos State government is much more concerned about the artisans in Lagos State as a whole. And it will also pass a message to other of our members outside there that the government is mindful of them.
This program also serves as one of the state government's contributions to the growth of small and medium-scale entrepreneurs. A 2018 UNICEF report says more than 47 children and adolescents die every day from AIDS-related causes in Nigeria. Low access to antiretroviral treatment and limited prevention efforts are the leading causes for these deaths. Now, in the face of the coronavirus pandemic, the situation is worse. Traditional birth attendants have a role to play, not only to slow down the rate, but to join medical professionals in this cause. There is no gainsaying. Many patronize traditional birth attendants for antenatal and delivery in Lagos State and Nigeria. To prevent the HIV transmission from mother to child and eradicate new infection by 2030, the Lagos State AIDS Control Agency is bringing traditional birth attendants into the picture. Monsurat Adeleke is the Chief Executive Officer of the state's AIDS Control Agency.
That you wouldn't be exposed to this kind of thing. So we all the things that we're focusing on at this training is how to strengthen the referral linkages. Immediately you see that you cannot handle this, please refer to all our facilities. We have 286 prevention of mother-to-child transmission facilities in Lagos State. We have ART sites, about 142. Even the Lagos State Ministry of Health, they've engaged them in a lot of capacity building on danger signs of pregnancies and all of that. So we continue to reiterate all these messages so that we can draw a line.
This training started in 2012, and Lagos State government has so far trained more than 1,500 traditional birth attendants on basic facts on HIV, prevention from mother to child, and referral of positive women.
This particular group, the traditional birth attendants, they are very key in the society because we have a poor health-seeking behavior in Lagos State. A lot of patronage goes to these people. So what we've done over the years is that we've done it in such a way that we continue to engage them and train them in different capacity buildings on different, interventions. So this is one of them, which is the prevention of mother-to-child transmission. You can imagine that if we nip it in the bud from them, the mother that has HIV will not transmit it to the child.
It's that tradition that Governor Babajide Sanwo-Olu has continued. These are the last batch of 100 persons trained this year.
We know much about our people in the community. They came to us and we gave them the guidelines. We are taught about how we can be able to get them tested. After being tested, then we try to make sure they get all the necessary facilities, the necessary drugs, that is, taking care of the pregnancy, and later refer them for them to be prevented against the HIV, and for the child to be prevented.
We used to refer them to the general hospital to do HIV test. Whenever we say that they have the HIV, we don't have the right to deliver them. They have to go to the general hospital when it is time for them. But what we just need to do is that we should pamper them, give them care, that this HIV you have is not the end of the world.
When a baby is born, within 0 to 72 hours, it's critical to placing the child on antiretroviral drugs to reduce the chances of the baby contracting HIV virus from the mother.
That's a package for you today on Inside Lagos. Many thanks for being a part of it. Remember, improper handling of face masks can spread COVID-19. Do not share, do not reuse without washing. All medical instructions are vital. Be responsible. Be safe. I'm Adedoja Salam Adeni. See you next time. Bye for now.